Dr. Seth Gerald again. So today I just want to give you a very brief overview of our weight loss program and what we do. So the Obesity Medicine Association recommends 4 pillars of weight loss. Number 1 is nutrition, number 2 is physical activity, number 3 is behavioral, and number 4 is medications. So let's start with number 4, medications. So when somebody gets started on a medication for weight loss, we usually are targeting their hunger centers, and most people do need those medications their entire life. Some people can wean off of those. But those who need them the rest of their life, it's kind of like treating the disease of hypertension or diabetes. We wouldn't start you on those medications and then stop you once we got you to goal, because most of the time you still have high blood pressure underlying and the medicines are making it right. So most people do need the medications the rest of their life. There are other things in the medication category, such as medications that cause weight gain or cause people to retain too much of their weight. So some of those medications we discuss at our visits about stopping, decreasing the dose, or if we can't do that because it's a medication that has no alternatives and you absolutely need it, then we overcome it in different ways. So that's number 4 is medications. Number 3 is behavioral. So many people think that weight loss is simply just move more and eat less, but there are so many behavioral things that we can do. So there's some really good books that talk about cognitive behavioral therapy in order to help treat with weight loss. Some of the things that we really focus on are anxiety, depression, any kind of psychiatric disorders, or just stress. All of these things can increase cortisol levels, which then increase the amount of sugar that's in your body, which then increase the amount of insulin, which can lead to weight gain. So what we really try to do is to decrease stress, decrease anxiety. Sometimes that is simply with some apps. Sometimes it's with a referral to a counselor, sometimes with this referral to a psychiatrist, or sometimes it's changing around current antidepressants or anti-anxiety medicines. The other part of behavioral is sleep. So we know that people who get 7 to 8 hours of sleep versus people who get 5 hours of sleep have lower levels of hormones that cause you to be more hungry. So getting good sleep is really important, and there's some apps that we work with for that as well, and some cognitive behavioral therapy, some things that we can do to help with your sleep. Other parts of behavioral include making sure you weigh yourself every single day. Some other behavioral changes are making sure that you use some kind of food log every day, whether that's a journal or whether that is logging your food in an app that's been shown to help people maintain their weight loss after they've lost the weight. Another behavioral change that we really encourage is that you have an accountability partner. Now, as you're on the journey with us in the weight loss program, we are there for you, but we strongly encourage a friend, a family member, somebody that's there with you that you can talk with about how you're doing, what kind of pitfalls you're having, are you logging your food, are you getting your physical activity, things like that. There's lots of other behavioral changes we talk at throughout the weight loss journey. So that's number 3 is behavioral. Number 2 is physical activity. So physical activity we know helps people maintain their weight loss. Now, it doesn't help every single person lose weight. Common myth. There's been some good studies to show that physical activity doesn't necessarily help with some people's weight loss. Some people it really does. But it helps with your overall health, and it definitely helps to maintain the weight that you've lost. So we start with 5 days of cardiovascular exercise, whether that's starting with walking or increasing that up to a light jog or getting on the stationary bike or even a non-stationary bike, getting in the pool, whatever it is to increase that heart rate 5 days a week. The second thing is 2 days a week of some kind of resistance training. We know that as you increase the amount of muscle in your body, you burn more calories. So that increases what we call your basal metabolic rate, how many calories you burn in a day just sitting there. So we want to start building muscle now, 2 days a week. You can actually do a lot of that at home now if you don't like gyms, with resistance bands or even with some YouTube videos that include body weight exercises. The last part of physical activities, we want to increase NEAT, N-E-A-T, non-exercise activity time. So those are the things that you can do in your everyday life to increase how much activity you get that does not include exercise. So things like walking up the stairs instead of taking the elevator, parking at the back of the parking lot, getting in your 10,000 steps a day, taking the long way to the bathroom, the little things that you can increase need. So that is number 2, physical activity. So we have hit medications, number 4. Number 3 is behavioral. Number 2 is physical activity. And number 1 is probably the one that is most important, which is nutrition. So my goal is I want to do something you can do the rest of your life. We could probably, with multiple different nutritional plans, get weight off of you. But can you do that the rest of your life? So looking at some studies, there's been plenty of nutritional plans, diets if you want to call them that people can lose weight. But do you maintain it? Because if you don't, every time you lose weight and regain it, what happens is your basal metabolic rate, how many calories you burn in a day, goes down because your body thinks you're starving. So we want to mitigate that, because if that keeps happening where you yo-yo, you gain weight, lose it, gain weight, lose it, gain weight, lose it, eventually your basal metabolic rate drops pretty low and it becomes very hard to lose weight and very hard to maintain that weight off. The second part is we want to choose something that's going to be healthy. So, for instance, lots of people do keto. No problem with keto for most patients. But can you do it the rest of your life is the first question. And the second question is, can you do it healthily? Some people will do what we call dirty keto, where they will eat cheese and pepperoni for dinner every night. And you'll probably lose weight. But the question is, how healthy is that? So when I say healthy, I want you to focus on decreasing the amount of processed foods. So if it comes in a box, it's probably not the healthiest for you. Processed foods turn into sugar very quickly, which then causes your insulin to spike. That is not something we want. So we want to try to get out processed foods, throw them away. The second thing is we want to focus on foods that are more natural. So your lean meats, your whole grains, your fruits, and your vegetables. Now, we can incorporate many different nutritional plans that include those two things, getting rid of processed foods and eating healthy. So how do we do that? Usually I either choose a lower net carb diet where we shoot for 50 to 70 net carbs in a day, or we choose a low calorie diet. And that depends on your height, your weight, what we expect your basal metabolic rate to be. And those goals transition if we're not losing weight. Sometimes we incorporate things like intermittent fasting. Sometimes we do Mediterranean diet. It really depends on what your goals are and what we think you can do the rest of your life. Sometimes we also check insulin levels to see if a patient's insulin resistance. I do focus more on the net carb aspect. So let's recap everything. Number 4 was medications. Number 3 was behavioral. Number 2 was physical activity. And number 1 was nutrition. And those are the things we'll go over every single visit. And incorporating each different aspect, because it is more than just eat less and move more. There's a lot more to this journey. All right, thanks. Have a good day.